Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, a nutrition scientist and director of the Integrative Medicine programs and the executive director of the Office of Integrative Medicine and Health here at GW.
Today, we're going to discuss evidence-based approaches to use food and the gut microbiome to prevent health and treat disease with Dr. Christopher Damman, a board-certified gastroenterologist and internist at the Digestive Health Center at the University of Washington Medical Center.
Dr. Damman is a physician scientist with a particular interest in the microbiome and functional foods. He recently gave a talk on the clinical application of the evidence base for dietary and microbial interventions to support well-being at our 6th Annual Sung Symposium, The Gut, Microbes, and Well-Being.
He's also a clinical associate professor of medicine at the University of Washington and an entrepreneur with 20 plus years of experience across the private, philanthropic, and academic sectors.
Welcome to the pod, Chris.
Lee, Jeanette, so great to be on. Thanks for the invitation.
Oh, absolutely. Especially after that wonderful talk and the great panel discussion we had at the Sung Symposium. We just had to have you on.
Well, that makes two of us. I suppose there's always opportunity for encores, to satisfy the continued desire to talk about microbiome. So it should be fun.
Oh, yes. There's always more desire for talking about microbiome. So let's get right into it. What are diet and microbiome-directed therapies?
Good question. Conventional medicine is very much reductionist, and it involves oftentimes, drugs or small molecules. The approach of using food and microbes is slightly more integrative or holistic approach. And the really neat thing about using food and microbes is it can impact so much in health. Health is, founded in many ways in food. Food is our medicine, as Hippocrates, the father of modern medicine, said over several thousand years ago. There's a lot of power there, and a power that I think the sort of conventional medicine is really starting to embrace in a bigger way. And there's movements afoot, even at the highest levels, level of government, that are starting to think about just how powerful food and microbes can be for impacting health and disease.
So what gets you the most excited about this area of research or on the clinical side as well?
Yeah, I think one of the areas that's most exciting is the potential to impact disease and prevent it from happening in the first place. I think, that's the power of a functional or holistic approach to medicine, is that one can prevent, diabetes, hypertension, if a healthy approach is taken right from the get-go. Now, what's new about what's coming down the pipe? I mean, we've known that healthy eating is important for overall health for a long time, for decades, maybe even millennia. And yet we have truly an epidemic of metabolic disease, of obesity and diabetes. So what are the new approaches to food and microbes that are coming down the pipeline? And some of those approaches involve really sophisticated delivery of the microbes themselves that are present in the gut, and certain rarefied group of individuals where those microbes are missing, not just underrepresented, but truly gone. That's probably not the majority of people. The majority of people, if the right food is provided, those microbes will grow and will become partners in health again within the gut and contribute to all the positive health outcomes. But that said, that microbiome approach to therapy is one that I think will be really impactful for certain types of diseases, like inflammatory bowel disease, and a diarrhea, a disease called Clostridium difficile. Beyond the microbe therapies, I think another really exciting area is better understanding how food is not just important for health and what types of foods are important for health, but how the microbiome translates the key components or bioactives within food that then impact our health. There's been a lot of research in the last 10, 15 years around this. And what's so exciting about that is if we can understand what it is in food that impacts the microbiome and impacts our health via the microbiome, then we can use those things specifically in concentrated ways to address health. And it just allows us to approach foods with our eyes more widely open and with more power. So I think that will be an exciting area as well. And then the last area is how technology like continuous glucose monitors, other monitors of other molecules within our blood that are really important for health, how smartwatches that measure pulse rate, and how technologies like just apps that help us choose foods in a healthier way, how all these technologies might come together to inform and empower the individual to make healthy choices in real time. So I think those are kind of the three big areas. It's microbes, it's new approaches to food and the bioactives in food, and then the technologies that will really truly enable more powerful behavior change, which has been the key rate limiting factor in folks adopting a healthier diet and healthier lifestyle.
Yeah, I would totally agree with that. The other thing that I feel like I hear a lot about in the big wellness or the influencer world is that all you need to do is change your diet. I'm obviously the first person to be like, nutrition is fundamental when we're talking about the microbiome. But you've already alluded to the fact that diet is probably not enough alone, at least in some cases, to actually affect the microbiome in the way it would need to be affected in some of these cases. Is that correct?
I love that. And I have a framework that I help keep all the different factors straight in my own mind. And it's what I call the 4 M's, which stand for the molecules or the foods, but also the toxins, the microbes, which are the healthy microbes, but also the pathogens. Movement, which is activity and exercise, but also kind of being a couch potato or lethargic. And then lastly, mind, which would be mindfulness practices, getting good sleep, but on the flip side, being stressed and not getting enough sleep. So those are kind of the 4 M's or pillars of health, and they all truly contribute to our overall health and well-being, not just food, as you say.
So one of the things that is really crucial for the microbiome and its relationship with food is that food is both the fuel for the microbes and a source of the microbes. How does that play into this relationship in terms of, providing what these microbes need, but also perhaps providing the microbes themselves? And is that different or better or worse than, say, a probiotic you might get at the store?
Yeah. So I think what you're alluding to are fermented foods. And fermented foods, especially those that have live active cultures, are ones that have live bacteria. Now, it's really important to recognize that the bacteria that are present in our food are not the bacteria present in our gut. Very different. They live in different ecosystems. They like different things. That said, foods that are fermented, whether it be the bacteria in those foods or the factors that those bacteria are producing, like lactic acid and acetic acid, which is just vinegar. Those things then support a healthy microbiome in our gut, the bugs that do like to hang out in our gut. There's a really interesting study that was done out of Stanford that gave advice to people on increasing fermented foods. And they found those that were successful at increasing things like yogurt and kimchi and sauerkraut, etc. Their microbiome diversity increased. But to my point earlier, it wasn't the microbes that are present in those fermented foods that increased in their gut. It was microbes that were probably already in their gut, just not at high numbers. And those fermented foods actually helped re-equilibrate the natural microbes in the gut. So it is very true that foods like fermented foods do provide microbes like probiotics. And if you were to compare the value of a probiotic versus, say, just giving a fermented food or eating more fermented foods, it really depends, A, on the specific condition, and B, the specific probiotic. And there are some conditions in probiotics for which there's actually pretty decent research that suggests taking that probiotic for that condition can be helpful. Now, if somebody were to come into my clinic and ask, should I take a probiotic, doc, without really any specific condition, I just heard it was good to take a probiotic. I generally tell them what I do, and that is I tend to focus on eating fermented foods, recognizing that there is some data like this study out of Stanford that suggests that fermented foods support a healthy microbiome. And to boot, the other thing that study showed is there was a decrease in inflammation as measured by blood markers. So that change in the microbiome then translates into a change within the body. So there you have it.
Yeah. Another thing that brings up to me is asking about, should I take a probiotic, and just how big that question actually is, because there are so many different kinds of probiotics and they're not the same. And like you're saying, most of them have certain indications. They might be good in this type of microbiome, whatever the baseline microbiome is, but they could actually have a negative effect in other types of microbiomes.
Well, that's an interesting question. And there was a study done out of Israel that looked at a pretty complex probiotic. I think it had upwards of about 20 different species in it. And it was given after individuals had taken a course of antibiotics. What they found was fascinating. The return of the healthy microbes in the gut in this particular study with these particular probiotics was found to be impeded by taking the probiotic, that people had their natural microbiome and flora return faster without taking the probiotic. And so that's one study which does bring into question the value of a probiotic approach.
Yes, and that particular study, which I am familiar with, I know there's kind of two caveats that go along with that. One is, were those baseline microbiomes "quote unquote" healthy, right? Or they actually, pre-disease microbiomes? That's one we don't know the answer to that. And the other one, and this is one that I've heard from a lot of clinicians, I think is a fair point, is the protocol that was used in that study was actually to administer the probiotic after the antibiotic instead of with the antibiotic. And you could see where that would have possibly a different effect.
Yeah, certainly possible. It's, maybe easier to keep things around rather than bring them back.
Yes, right.
Yeah, but I mean, when we take antibiotics, just a single, standard course, our microbiome is incredibly resilient, and all of those bugs are not lost for good. They actually hang out in certain parts of our gut. Actually, the appendix is one of them. So the appendix may actually have a function.
Imagine that.
Yeah. But they hang out in certain places, and then they come back. And most people, most times, it's just when you take really long courses of antibiotics or repeated courses of antibiotics or very broad spectrum antibiotics, that over time you can lose some of these species. I mean, think of it like a lawn, and let's say your lawn has some weeds in it. You can give weed killer, which is like antibiotics, and that will get rid of those weeds to a certain extent, and will bring some of the grass down as well. But then, with time, the grass comes back, and it might come back a little bit stronger. So antibiotics are incredibly important. They have saved millions of lives since the discovery of penicillin just before World War II. But they do have their caveats, and it's important to use them wisely. And these are big conversations that are happening within clinical medicine, because there's also the issue of antimicrobial resistance, where with time we won't have antibiotics that work anymore because all of the bacteria will become too savvy; they'll be resistant to them. But, there's good reasons not to use antibiotics. There's very good reasons to use antibiotics too, and the role of the clinician or provider is to know when to and when not to, and the role of patients is to heed that good advice when it's provided.
Right, and to utilize those antibiotics properly, and you take them according to directions, as opposed to, taking half the course and then just stopping. Or, I actually, back in the day, I remember my family would get antibiotics for anything. You just call the doctor, and they would write you a script for antibiotics. You didn't even have to come in. That was obviously not good practice, and I think we've all gotten wise to that, even on the consumer side. But I think there's still maybe some people who are a little bit more, keen towards one or the other, like being very pro-antibiotic or being very anti-antibiotic, when really neither of those are probably correct. It's about a smart use of antibiotics.
Well, here's a corollary, a parallel to that conversation, and it's one of hygiene and cleanliness. Hygiene is incredibly important. I think back to some of our early lectures at medical school and learning about John Snow and the one that discovered cholera, and was one of the first people to recognize that microbes can contribute to disease. He isolated the outbreak of cholera within a town to this one well, so that's an example where having clean water is really, really important. And similarly, washing hands after visiting somebody in a hospital room is really, really important. There's tons of studies on this. And yet there's probably a Goldilocks phenomenon here. Now, not in the context of a hospital, but at home, do we want to use antimicrobial soaps, antimicrobial counter washes? Do we want to be super careful and not, go out into the garden without gloves and, protect ourselves at all costs from any microbes? The answer is probably no. Microbes are really important, really healthy, and exposure to them is probably really important of health as well. And I would say as a society, we may have erred a little bit too far on the side of sterility and ultra cleanliness. And how does this boil down into practice? Well, in my house, if we're not in a hospital or a bathroom and something falls on the floor, we don't have the 5-second rule. It's more like the 5-minute rule. So.
Same here. Absolutely. I'm with you. It's good for your microbiome.
Yeah, exactly. And, it's important to wash hands, but do we use antimicrobial soaps? No, we just use standard soap.
Right. Which actually does a pretty darn good job.
And vinegar is a wonderful
yes.
as well. So there's ways of finding that just right spot, the Goldilocks spot, in our hygiene. And I think as a society, we would do well to sort of re-equilibrate and find that balance again.
It's a really important point, particularly because when you think about some of these strains that are found in probiotics, where they come from, many of them come from soil. So it's kind of ironic that we're keeping ourselves away from some of these natural sources, and then we're spending a fortune on getting these artificial sources of the very same bugs.
I love it. Yes, it's so true. And there's a lot of really compelling and good reasons for going outside. And being exposed to soil and these good bugs is one of them. Sunlight and the vitamin D that we make in our skin is another really important one.
Oh, you're preaching to the choir on that
Movement, right? When you get outside, you're walking, you're moving, you're getting exercise. Mm-hmm. These are all really important parts of health that tie into the different pillars or M's that I talked about before. And as a society, again, we don't do that enough. We're this society that loves our dwellings, and we move from house to car to office, back to house again.
Yes. And sometimes the movement from car to building is actually through a garage, so you aren't even going outside.
That's right.
Mm-hmm.
So, Chris, how are hangry bacteria, as it was so brilliantly said in a headline of an article that you wrote, in your gut microbiome linked to chronic disease?
Well, first of all, it's a fun title. Bacteria don't really...
I know it's probably misleading because I know it was written by, non-health professionals.
Yeah.
But I loved it.
They're words that I've used before, for sure. And it is eye-catching to call our microbiome hangry. Truthfully, they don't have a central nervous system, so they can't really be hangry. But hey, we anthropomorphize a lot of things, so why not our microbiome?
Yeah.
But what do I mean by that? Essentially, we've been starving them, and we've been starving them because we haven't been feeding them the things that they prefer to eat. We've processed them out. Fiber is a big thing. Most of our processed foods are missing fiber. They're also missing phytonutrients like polyphenols. And these are both really important for supporting a healthy, well-balanced microbiome. When they don't receive these, then some of the less happy members of our microbiome can increase and cause inflammation. And similarly, when we don't have things like fiber and polyphenols, the good guys are not making the healthy compounds that they normally do that are actually really important for our health. Things like short-chain fatty acids, like butyrate. So if you don't feed the microbiome, they will be in some ways hangry at us. And we'll be hangry too. Sorry, right? Like that translates up to our true hangriness or central nervous system. I don't know. It's kind of a weird twist to think about, but who's really in charge?
Mm-hmm.
Is it our brains or is it our gut microbiome? Because we're in fascinating research, we're learning that the microbes are involved in regulating our appetite and in our mood, and maybe even a little bit in our personality. There's decent literature to support all of those, growing literature to support all of those comments. And I have this image that comes to mind that's a bit on the macabre, and a saying, and it's meat puppets. Like in some ways, we're really just these marionettes at the whim of our microbes.
Okay, I really wish you hadn't said that, because you know what my mind went to? It went full tilt zombie ant.
Yes.
Oh gosh, yes.
Yes.
Cordyceps.
Yes. Yeah.
Chris,
There's more examples of that too. Toxoplasmosis gondii.
Yeah.
Is another one. So that's a really interesting story. So Toxoplasmosis gondii is a parasite that's harbored in lots of organisms, including mice. And they found that mice that have this organism actually lose their fear response around predators. And so they're actually more likely to be consumed by cats.
Aren't they actually attracted to cat urine?
I think you're right. Yeah.
Yeah.
It goes even further.
My public health background is slightly out of date, but it's still back there.
I think you're right. I do recall that. So so then the cats eat them, and they end up spreading the disease further.
Friends, I have to apologize for making us go down this appalling conversational path. Let's get back on task.
You have a lot of fun at our dinner table, Jeanette. I imagine with a GI doc as a father of three girls.
That's all right. That's good for them.
Yeah, mm-hmm. But we can steer off this course for sure.
Well, one of the things that you already sort of alluded to was perhaps the perils of ultra-processed foods and the emergence in literature on ultra-processed foods showing that they are uniquely detrimental to health is really starting to strengthen. But I know that you have a mind into how maybe we can find a happy medium between no ultra-processed foods or the current state where people are eating all of these foods and it's destroying their gut microbiomes.
Yeah, Lee, so I'm a pragmatist, and the solution that is going to be implementable is going to be the best solution. Now, we should find new, exciting ways to inspire people to eat whole foods, to cook whole foods. But we've been giving this public health messaging for decades now, and the obesity and diabetes epidemic is only getting worse. So I think we need complementary tools. And one of those solutions are things like technologies or smartphone apps or real-time trackers of your health that can maybe give you more immediate feedback on how that food that you're consuming is impacting your health, and let you see in a very real way that eating different types of food will lead to healthier outcomes. So I'm a big believer in how technology is going to be helpful there. But similarly, I think, and it goes back to what we were talking about earlier, if we understand what it is about whole food in a better way, that makes it healthy. And we've learned so much over the last 100+ years. We know about proteins and fats and carbohydrates and vitamins and minerals. We've decoded all of that. And yet there's probably still parts of food, some call it the dark matter. Others allude to it as the sort of periodic table of food. And there's the more exotic components, like the transition elements for those chemists out there. There's an effort out of Rockefeller along these lines to characterize all these other components of food, like specific fibers and the phytochemicals and other things too, certain fats. And what's helping us understand how those things are impacting our body is actually the microbiome, because the microbiome plays a really important role in translating those factors and shines the light on why they're important in the first place. So that's all a long way to say, what if when we make a food, and I'm talking about a processed food, what if we pay attention not just to the macro and the micronutrients, that list of things, proteins, fats, et cetera, I made before. And those are really important. We should pay attention to those. But what if we also paid attention to what I call the bioactives in food. Those are the fibers and the phytochemicals, the dark matter, the periodic table elements that we're still kind of discovering. If we took that more holistic approach to designing foods, I would say we could get a lot closer to healthy processed foods than we are right now. And a first blush approach is just putting fiber back in. And all fiber is not equal. There some fibers, do some things better at growing microbiome. Other fibers might be better for happy bowel movements. But categorically adding fiber back into food, I think could
Or
make
perhaps not
it easy.
removing it in the first place.
Well, there you go with the Whole Foods. Yeah, or not removing it in the first place. So yeah, and I think if we can achieve 70% of the benefit when we're maybe down in the 40 and 50 benefit of food with the processed food, that's incrementally better, and that people will be compelled to eat because it looks a lot like the things that they're already eating. I think that's a win.
Yeah, I agree. I think that's a win. There are a lot of people out there who would disagree with that. And I think that they're letting perfection be the enemy of good, or even perhaps good enough. For some people, this may be good enough, right? It fits in their lifestyle. Their family will be supportive of it. It's sustainable for them. Whereas something beyond that perhaps is not something they're even open to. And so thus it's kind of a moot point.
Yeah, no, I like the way you put it. That perfection is the enemy of good. I think that sums it up really well.
Chris, according to your bio, and you can tell me whether this is wrong or not, you're the former initiative lead of the gut health in the enteric and diarrheal diseases team at the Gates Foundation. Now that's a mouthful. What is the Gates Foundation trying to accomplish, and are you still affiliated with them?
It is a mouthful, and I, remain good friends with my colleagues at the foundation, and the Gates ecosystem, is greater than the foundation, and I do play a role there as well. But what is we were working on, and what continues in really exciting ways, are using not just food approaches to address malnutrition, but use foods that target the microbiome, next generation foods, and microbes themselves to improve malnutrition. When I say malnutrition, I'm referring to a certain type of malnutrition, and that is wasting, stunting, and actually preterm birth falls into this as well if you move even earlier in the life cycle. And that was actually a powerful trajectory in our learning over the course of my 5 years there, is how important it is to intervene early. And a lot of the work now is actually happening in women of childbearing age and in the maternal setting. Recognizing that there's more impact there ultimately with intervention. And some of the therapies that we're working on, there was work being done by Jeff Gordon at Washington University of these microbiome-directed complementary foods in a trial that was run that showed, compared to just a standard ready-to-use therapeutic food in folks that were malnourished, it helped them grow statistically significantly better than just the standard ready-to-use therapeutic foods. And what's more, what's actually really interesting is that microbiome-directed complementary food actually had slightly fewer calories in it. Yeah, maybe not statistically so, but it was still notable. They were matched as close as possible, but it actually had fewer calories, and yet the kids grew better. So that says it's not just calories that's important, not just the micronutrients, which are also standardized across the two interventions, but other factors, probably like fiber and phytochemicals or phytonutrients that are present in foods. That are really important for helping kids grow and be healthy.
Well, we are running short on time, so I want to give you time for one last final comment with the prompt of, if you are a clinician listening to this podcast, what would be one tip you would want to give them?
Well, I think food is the foundation, and find your approach to food that works. Food is almost a religion for a lot of people. It's very personal. Culture is so integrated with food, and it's not always a one size fits all. It's also true that certain medical conditions may preclude approaches to food that would be healthy for one person, but not for you. So recognize that approaches to food are somewhat personalized. That said, there are general rules that apply, rules that are relevant across the whole population. And Michael Pollan said it well in his book Defense of Food, and that is eat food, mostly plants, not too much.
Couldn't agree more.
One of the best advice I've ever heard.
Yeah.
You can make things as simple or complicated as you want. And at the end of a long, fascinating journey, that's what I always come back to.
Well, that is the perfect way to end. Thank you so much. And thank you so much for joining us, Chris.
Yeah, this has been great. I really appreciate the invitation, and it was fun to extend our conversation from the lecture.
Yes, agreed. This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health. I'm Dr. Lee Frayne.
And I'm Janet Rodriguez.
Thanks for listening. The Office of Integrative Medicine and Health produces the GW Integrative Medicine podcast with funds from your donations. Your generosity allows us to raise awareness of the benefits of integrating whole person care, including evidence-based complementary therapies, into healthcare broadly. Help us continue to grow the podcast by making a tax-deductible donation on our website, smhs.gwu.edu/OIMH. Click the Give Now button on the left. While you're there, sign up for our free monthly newsletter for even more evidence-based content, including free webinars.